Hi, my name is Morgan Atkinson. I'm an exercise physiologist from the Youth Cancer Service. Today I'm going to be talking about cancer-related fatigue and the role of exercise. So what is cancer-related fatigue? Cancer-related fatigue is an unusual, persistent and subjective sense of tiredness that is not proportional to recent activity and interferes with usual functioning. Now, the difference between cancer-related fatigue and normal fatigue is that normal fatigue is often caused by either a lack of sleep or overexertion and is often relieved by adequate rest or adequate sleep, whereas cancer-related fatigue is more severe, more persistent and more debilitating than normal fatigue and is not relieved by adequate sleep or rest. Cancer-related fatigue can also have a detrimental effect on your quality of life and also activities of daily living. So it really can become quite a significant issue for some patients. So how prevalent is cancer-related fatigue, or what percentage of cancer patients get cancer-related fatigue throughout their treatment? Now, the studies can be a little bit conflicting with regards to the percentages. I've seen some studies that suggest 20%, some that suggest 100%, but a recent analysis of the research suggests that somewhere around 90% of cancer patients experience some form of cancer-related fatigue throughout their treatment. Now, this probably reflects the variety of populations in which cancer-related fatigue has been studied, and also the subjective nature of the condition, meaning that there is no one diagnostic tool to diagnose cancer-related fatigue. Furthermore, cancer-related fatigue often appears to extend beyond the active treatment period. Now, there are many individuals with no clinical evidence of cancer who continue to experience cancer-related fatigue months and sometimes even years following the completion of treatment. And there have certainly been studies that have looked at patients that are 5 years post their cancer treatment, and around about a third of those patients have experienced cancer-related fatigue even 5 years after the completion of their treatment. So it certainly can be a debilitating condition that certainly for some people needs to be treated and addressed so that it doesn't impact on their quality of life and also the activities of daily living. So how do we assess cancer-related fatigue? Now, there are several instruments that have been validated to screen for and assess cancer-related fatigue, but not one of those tools is diagnostic. Now, with regards to the diagnosis of cancer-related fatigue, it's usually made by excluding other treatable symptoms such as hypothyroidism, anemia, pain, medication adverse events, electrolyte disturbances, organ dysfunction, or sleep disturbances and emotional distress. So once these potential factors, medical factors, have been addressed and considered and ruled out, patients should then be screened for cancer-related fatigue. So how do you assess cancer-related fatigue? Now, there are a number of assessment tools that are really simple to administer. They're normally questionnaires that can be done either online or in paper form. They're easily accessible, again, they're downloadable online, and normally they're free. Now, there are two common cancer-related fatigue assessment tools that are used in the literature. One's the functional assessment of cancer therapy, or the FACT instruments, and also the Piper fatigue scale are the two most common questionnaires to assess cancer-related fatigue. There are also a number of other assessment tools that are used to assess cancer-related fatigue, but they're not as widely used. However, they could still measure your cancer-related fatigue. So if you're wanting to measure your cancer-related fatigue, go online, Google, the FACT instruments or the Piper fatigue scale, download them, and you can assess your fatigue really easily and simply. So how does exercise reduce cancer-related fatigue? Now, the mechanisms by which exercise reduces cancer-related fatigue are not well established. So there are a number of theories as to how exercise might reduce cancer-related fatigue, and they include the fact that exercise may protect from treatment-related increases in cancer-related fatigue, as opposed to reducing fatigue itself. Exercise may reduce cancer-related fatigue by increasing aerobic fitness and muscle function. We also know that cancer-related fatigue is highly associated with physical distress factors like pain, insomnia, and psychological distress, such as depression and anxiety. So it's thought that exercise may be able to reduce cancer-related fatigue indirectly by its beneficial effects on mood, immune function, and sleep. And also there's a thought that exercise may decrease inflammation by increasing the level of anti-inflammatory cytokines. So whilst we don't know the exact mechanism for reductions in cancer-related fatigue related to exercise, we do know that exercise is beneficial for cancer-related fatigue and is also cheap, safe, and easy to administer. So it's a fantastic intervention to help improve your cancer-related fatigue. So what are the evidence-based interventions to assist with cancer-related fatigue? Now, the most effective and established method to improve cancer-related fatigue is actually exercise. Exercise effectively improves cancer-related fatigue, especially if you're adherent to the exercise program. If you're not adherent to the exercise program, the benefit reduces. There are also other forms of interventions that are likely to be effective. However, the evidence is a little bit limited at this stage. So talking about things like psychoeducation, so talking to a psychologist or a social worker, putting in place techniques to help improve your sleep, fatigue, and depression. Progressive muscle relaxation can be beneficial. We know that if you engage in a multi-dimensional rehabilitation program, that might be helpful too. And also management of concurrent symptoms, like we've discussed previously, can be really beneficial to help eliminate some of those factors that might be causing your cancer-related fatigue. There are also medications that might be able to help to improve your cancer-related fatigue. However, they often come with side effects. So we know that steroid treatments can improve your cancer-related fatigue, and also stimulants to stimulate your red blood cell counts can also help to improve your cancer-related fatigue. However, they're likely to come with some side effects. So the most established and effective method to improve your cancer-related fatigue is exercise, if you're adherent to the actual exercise program itself. There are also a number of other interventions, supplements, and therapies that people might use to help to improve their cancer-related fatigue. But at this stage, the effectiveness of those interventions is yet to be established, so we can't say that they might be beneficial or not. So what are the benefits of exercise for cancer patients? Now, we know that if cancer patients exercise at the appropriate intensity, duration, and frequency, that they're probably going to see improvements in their aerobic fitness, their muscular strength, and also their functional ability. Secondly, we're probably going to see reductions in cancer-related fatigue and also psychological distress. And thirdly, we're probably going to see improvements in your quality of life across multiple general health and cancer-specific domains. So exercise is really beneficial at improving your function, reducing your fatigue and psychological distress, and improving your quality of life, if it's done appropriately. But probably the exciting thing that's starting to emerge in the research is that physical activity and exercise may provide a protective effect against cancer recurrence, cancer-specific mortality, and all-cause mortality for some types of cancers. And those cancers are breast, colorectal, and prostate cancer. Unfortunately, we don't have that evidence in blood disorders just yet. But as this evidence starts to emerge, I'm sure we're going to see studies in blood disorders. So recently there have been a number of governing bodies publishing exercise guidelines for cancer patients. So the Clinical Oncological Society of Australia, or COSA, Exercise and Sports Science Australia, or ESSA, and the American College of Sports Medicine have all published guidelines for cancer patients. And those guidelines state that cancer patients should attempt to avoid inactivity and sedentary behaviour as much as possible and return to normal everyday activities as soon as possible following their diagnosis. It's also noted that if you're able to exercise in a structured way, that the program should be tailored to the individual's ability, and there may need to be adaptations to the training program for people, especially when they're going through their cancer treatment, to take into account any treatment-related side effects and or changes in your health status throughout treatment. And the best people to prescribe your exercise program are accredited exercise physiologists or physiotherapists who are trained in cancer, because there can be various issues relating to your health that could affect your ability to exercise throughout treatment, and making sure that it's safe is really important. So an exercise physiologist or physiotherapist who are trained in cancer are the best people to help prescribe an exercise program for you. Furthermore, exercise can be delivered across a variety of settings when you're going through your cancer treatment. So it can be prescribed when you're in hospital undergoing treatment. In fact, it's really important that you maintain a level of activity when you're an inpatient. It can also be done at a treatment centre, a community centre, or even when you're at home. And in fact, it probably should be done across multiple different sites when you're going through your cancer treatment, so that you don't regress functionally and you are able to maintain activities of daily living, and also to alleviate some of that cancer-related fatigue that you might be getting throughout your cancer treatment. So just summing that up, avoid inactivity and sedentary behaviour. Be as active as your ability and condition allows. Sometimes you may need to adapt your training program throughout your treatment process. Seek out an exercise physiologist or physiotherapist to help prescribe an exercise program if you're having troubles. And you should be exercising not only in hospital, but when you're at home, and also in community centres if it's appropriate throughout your treatment process. So we know that exercise is an effective tool to improve your cancer-related fatigue. So how do we exercise during cancer therapy? Often patients have concerns about safety or simply just aren't aware that they can exercise during cancer therapy. So the current recommendations state that although there are specific risks associated with cancer treatments that need to be considered when survivors exercise, there seems to be consistent evidence that exercise is safe both during and after cancer treatments. So really, we want you to exercise, but we want you to be aware of the safety concerns and also the appropriate prescription to help improve your cancer-related fatigue. So what are the appropriate exercise guidelines for cancer patients who are wanting to reduce their cancer-related fatigue? Bearing in mind that the initial message is to be as active as your ability and condition allows. And for some people, that's all they're going to be able to achieve. For some people though, they may want to increase their exercise beyond that message. And we're going to use some principles called the FIT principles to help guide our exercise prescription to improve our cancer-related fatigue. Now the FIT principle is the frequency, intensity, type and time of exercise required to give us benefit. So in terms of the frequency, we want to be aerobically active on 5 to 7 days of the week. And if we choose to do so, 2 to 3 resistance training sessions. In terms of the exercise intensity, we want low intensity exercise to improve our cancer-related fatigue. So a low intensity is basically if we're going for a walk and we're able to talk comfortably, that would be considered low intensity. If we're going for a walk up a steep hill and we can't talk because we're breathing too heavy and the heart rate's up, that would be considered high intensity. So the talk test is a good measure of what your intensity is when you're exercising. So for a low intensity, talk comfortably. For high intensity, unable to talk when you're exercising. In terms of the types of exercise to improve your cancer-related fatigue, aerobic exercise is better than resisted exercise, or a combination of aerobic and resisted. So aerobic exercise is best. If you have functional deficiencies or reductions in muscular strength, we certainly can add some resisted exercises. And those resisted exercises might be body weight exercises where we don't use equipment, or exercises in a gym where we're using machine weights or free weights. And we tend to want to do 8 to 10 exercises that target large muscle groups. In terms of the amount of time that we should be exercising each day and each week, we're looking to try and achieve 30 minutes of exercise per day or 150 minutes of exercise per week. And that may seem like quite a lot, but when we break that down into smaller bouts of exercise more frequently, it's quite manageable and achievable for most people, even when they're going through their cancer therapy. Just a few tips to help improve your cancer-related fatigue. The consistency in your exercise is really the key. The more consistent you are, the greater the benefit in terms of reducing your cancer-related fatigue. So consistency is the number one thing. If you're finding it difficult to get half an hour of exercise out in one bout, it's perfectly acceptable to do shorter bouts of exercise more frequently. So you might do 2 or 3 bouts of exercise throughout the day to try and achieve your 30 minutes of exercise. And the other take-home message is that incidental activity is really important. So incidental activity refers to the activity that is not structured and is incidental. So you might be going to the hospital and you're going to see the doctor. As opposed to taking the lift to get up to the second floor, you might take a flight of stairs. Or you might park your car further away in the car park, so you've got to walk a little bit further to get to and from appointments. And those little bits of incidental activity really add up throughout the day, throughout the week, and can help to reduce your cancer-related fatigue. So there are specific exercise recommendations for cancer-related fatigue. Recently there was a meta-analysis that looked at cancer-related fatigue and exercise and provided some clinical recommendations for patients. And those recommendations are that aerobic exercise seems to be better than a combination of aerobic and resisted exercise to improve cancer-related fatigue. So when we talk about aerobic exercise, we could be talking about walking, jogging, stationary cycling, and even swimming if it's appropriate. In terms of the exercise intensity, low intensity seems to be better than high intensity. However, there's no real significant difference between high and low. So if you've got issues with pain or mobility, low intensity exercise program is just as good as a high intensity exercise program at reducing cancer-related fatigue. With regards to adherence to the exercise itself, this is the real take-home message, that high adherence to the exercise results in a large effect, meaning a large benefit, whereas low to moderate adherence to the exercise yields a smaller effect or a small effect. So it's really important that you adhere to the exercise. It can be either high or low, and low seems to be better than high in terms of intensity. And you're better off exercising aerobically than you are a combination of aerobic and resisted exercise to reduce cancer-related fatigue. So with regards to myeloma-specific exercise guidelines, there are a number of absolute contraindications that would exclude you from exercise if you were to have these conditions. So if you had a spinal cord compression, an unstable vertebral fracture, or even a fracture within the last 6 weeks, untreated heart failure, or another severe comorbidity that might limit your participation in exercise. I actually think there is a significant role for the haematologist to assess safety and to perform a systematic assessment to assess how appropriate you are to exercise. And that assessment might actually include the impact of your bone disease to determine any restrictions. It might include a CT scan, an X-ray or an MRI of the skeleton to capture the site, size of the osteolytic lesions, and if applicable, the time since fracture and moreover the degree of pain. So all of those factors could influence your ability to exercise, and certainly your haematologist is the best person to talk to discuss whether exercise is appropriate. And currently there are some exercise guidelines that have been developed by a group in Canada for people with bone cancer or metastatic disease affecting the bone. So hopefully in the not too distant future, we're going to have some guidelines around how cancer patients who have bone disease or myeloma can exercise safely. So here are some tips for exercising when you feel fatigued. I think it's really important to pick an activity that you enjoy doing. If you enjoy that activity, it's going to be much easier picking it up when you're feeling fatigued and tired or unwell. Also find a time to exercise that works best for you. If you don't like getting up in the morning, don't try and exercise first thing in the morning. Do it at a time that works best for you. Also set both short-term and long-term exercise goals. So a short-term goal might be, I want to try and do 3 days a week of walking around the block for 15 minutes. A longer-term goal might be, I want to try and extend that walk out to 5 days per week for half an hour to 45 minutes. Take breaks. Take rest breaks if you need them. Break the exercise down into shorter bouts. If you're taking rest breaks, it will help you to stay active for longer. And if you're staying active for longer, you're going to get more benefit. You can also track your exercise time and progress it on a chart. So often an exercise physiologist or physiotherapist will record what you're doing and try and progress that over time. This can also be motivational to see how much progression you've had over a period of time or regression over a period of time to help guide the exercise prescription. Also exercise with family and friends or even pets if it's appropriate. So exercising with a family member or a friend can often be motivational. They can help you to become more active and they can probably in some ways challenge you as well. So exercising with a family member or a friend can be a good way to help motivate you. Also, don't force yourself to follow a strict routine if that's not what you like doing. Stop when you need to. You really need to judge your level of fatigue and you need to understand your fatigue. If pushing yourself, if your exercise intensity is too much or the volume of exercise is too much and you're feeling more fatigued by exercising, you need to adjust your prescription. So hopefully some of these tips can help you to become more active throughout your treatment. And if not, seek out professional advice, talk to your doctor or talk to an exercise physiologist or physiotherapist. So how do we access an exercise physiologist or physiotherapist? Now there are a number of ways to access an exercise physiologist or physiotherapist. Probably one of the easiest ways to access an exercise physiologist or physiotherapist is to get a chronic disease management plan through your GP. And via that plan, you can actually get up to 5 free sessions with an allied health provider. Those sessions should be bulk billed. Sometimes they're not, so check that before you go and see the exercise physiologist or physiotherapist. And it allows you to access EP or physio services if you can't afford to pay privately. So go and see your GP, ask about a chronic disease management plan, and you may be able to access up to 5 sessions per calendar year for exercise physiology or physiotherapy services. And those 5 sessions can be used to develop a program. They can be used to assess your functional capacity and reassess your functional capacity. And it can help you to perhaps get started. For people that are lucky enough to have private healthcare rebates, most healthcare providers provide rebates for exercise physiology and physiotherapy services, which can make exercising under supervision much more affordable. Also, you may be able to access an exercise physiologist or physiotherapist through the hospital system that you're in. So be sure to ask your doctor or nurse if you can access exercise physiology or physiotherapist through your hospital system. So how do you find an appropriate exercise physiologist or physiotherapist to help you develop an exercise prescription? Now you can log on to the Exercise and Sports Science Australia website or the Australia Physiotherapy Association website and locate an exercise physiologist or physiotherapist to meet your needs close to home. And both associations have search engines where you can find someone that has the appropriate qualifications and is located within a fairly close proximity to where you live. With regards to further resources to help manage your cancer-related fatigue, the Cancer Council of Australia have a brochure and it's titled Coping with Cancer-Related Fatigue, Information for People Affected by Cancer, which has some really good tips and hints about how to improve your cancer-related fatigue, as does the Australian Cancer Survivorship Centre. They also have a brochure called Dealing with Cancer-Related Fatigue. And there's also a really interesting YouTube clip by Dr. Mark Evans who explains cancer-related fatigue and how to manage it. So use those resources and they might be able to help you reduce your cancer-related fatigue. So summing that all up, I think this is a really important message. And if you don't take anything else away from this discussion today, really think about this. Recent exercise guidelines indicate that when individuals with chronic conditions, such as cancer, are unable to meet the stated physical activity recommendations on the basis of their health status, they should be as physically active as their ability and conditions allow. And an explicit recommendation was made to avoid inactivity, and it was clearly stated that some physical activity is better than none at all. So really, it's really important that you be as physically active as your ability and condition allows and avoid inactivity if you can't meet physical activity recommendations. Thank you.